Hello, everyone. This presentation will be on the human immunodeficiency virus, and the presenters are Eric, Lydia, and Brittany. So, starting with what is HIV? It is a viral pathogen that specifically targets the immune system. It impairs the capacity of effectively combating various infections and illnesses, and if left untreated, the progressive deterioration may eventually result in the development of acquired immunodeficiency syndrome, which is AIDS. AIDS refers to the advanced phase of HIV and is characterized by the significant impairment of the immune system that it causes. And this condition renders individuals, particularly those that are vulnerable to serious infection and illness, that might be potentially fatal. So now we get into the agent of HIV. And HIV is attributed to the etiological agent classified as the retrovirus. Retroviruses include a group of RNA viruses characterized by their distinctive capability to undergo reverse transcription, whereby their RNA genome is transcribed into their DNA when invaded by the host. HIV has two main subtypes, HIV-1 and HIV-2. HIV-1 is the predominant and intensively prevalent strain of HIV, and the worldwide HIV epidemic is attributed to it. HIV-2 has reduced virulence and it's a slower progression compared to HIV-1. HIV-1 and HIV-2 impair the immune system by targeting CD4 T cells, which are necessary for immunity, and the virus replicates in these cells, weakening the immune system and causing AIDS if left untreated. Transmission may occur via the interchange of various body fluids, including blood, breast milk, semen, and vaginal secretions, between an individual who is infected with the virus. It may occur also during pregnancy and childbirth, resulting in the transmission of the virus to the offspring. And transmission is unlikely to occur via routine interpersonal interactions, such as kissing, exchanging handshakes, or sharing personal items such as food or beverages. So, again, this is direct contact, and the transmission of HIV occurs by direct exposure to the bodily fluids that we have mentioned before. And in the context of the United States, the primary modes of HIV transmission are normally attributed to engaging in anal or vaginal intercourse, as well as sharing a needle or syringes with individuals who have tested positive for HIV. Now, moving on to typical symptoms of HIV, starting with the incubation period. Early HIV symptoms most often appear within 2 to 4 weeks after a person catches the virus, and up to 90% of individuals who are infected with HIV will report presence of symptoms during the first phase of the illness. And the first stage of the HIV illness is known as acute HIV infection, and it might manifest as a condition resembling other infections such as influenza. As for early symptoms, the illness spreads faster in the first few months following infection, although many don't realize it until later. And in the early weeks following infection, symptoms may not appear. However, others may have flu like symptoms such as fever, headaches, rash, and sore throat. When it comes to severe symptoms, the infection will gradually decrease immunity, so this can induce additional symptoms such as swollen lymph nodes, weight loss, fever, diarrhea, and cough. And in the absence of appropriate medical intervention, individuals affiliated with HIV infection are susceptible to the development of severe medical conditions such as tuberculosis, severe bacterial infections, and others. HIV severity and disease progression varies by person. HIV infection outcomes depends on viral strains, host immunological response, and ART availability. HIV is a dangerous illness, but breakthroughs in medical history, particularly ART, have improved the outlook for HIV patients, enabling them to live longer and better lives. HIV infection management requires early diagnosis, healthcare, and medication adherence. The pathogenicity of HIV is high. CD4 T cells, which are essential for the immunological response, are infected and targeted after transmission. The virus destroys these cells by replicating, and the immune system weakens with infection, making infectious and malignancies more likely. HIV exhibits a notable degree of infectivity due to its high transmissible nature, enabling transmission by direct exposure to certain bodily fluids. A moderate amount of virulence is seen in HIV. HIV may cause a variety of health issues and consequences, such as AIDS, which is characterized by a severely suppressed immune system, and it increases infections and development of illnesses. So, HIV infections may develop into AIDS, which can be fatal, as we have discussed in previous slides. So when we look at who does HIV typically affect, so the vulnerable group is in the demographic in the United States at least are most at risk for contracting HIV are those men who have sex with other men, whether they are homosexual males, bisexual men, or anything within the nature, and also people who are exposed. So this is people living in areas where HIV prevalent rate is high, and they reside in an area where a significant percentage of the population has HIV, and it raises the likelihood of contracting the virus if they have sexual contact or sharing needles with those who are positively infected with HIV.
Thank you, Brittany. And so now we'll be moving on to HIV statistics, starting off with incidence. And in 2019, there was an estimated 34,800 new cases of HIV in the United States. When broken down, we see the different rates per 100,000 population, starting off with sex at birth, where males had a rate of 21 compared to females at 4.5. For the different age groups, we see that those individuals aged between 25 to 34 had a rate of 30.1 compared to individuals aged 35 to 44 with 16.5. When specifically looking at ethnicity, African Americans were found to have a rate of 42.1 compared to Hispanic Latino at 21.7. And specifically for our county, there were 1,400 new HIV cases in the Los Angeles County. And now moving on to prevalence, in 2019, an estimated 1,189,700 people were living with HIV in the United States. When broken down by category, we see the different rates per 100,000 population, starting off with sex at birth. Males had a rate of 685.9 compared to 187.1 for females. When looking at the different age groups, those individuals aged from 45 to 54 had a rate of 709.4 compared to 547.3 for individuals aged 35 to 44-year-olds. When looking at ethnicity, there was a total of 479,300 African Americans living with HIV compared to 294,200 Hispanic and Latinos living with HIV. Specifically for the county, there was 54,000 people living with HIV in the Los Angeles County. When looking at HIV around the world, in 2022, incidence was 1.3 million new cases, comprised of 130,000 children and 1.2 million adults. Men actually had a greater incidence compared to women. And when looking at the different regions, Africa, European, and the Americas had a greater incidence compared to Eastern Mediterranean countries. And so for prevalence, there was a total of 39 million people living with HIV, where 1.5 million were children and 37.5 million were adults. For this case, women actually had a higher prevalence compared to men. And when looking at the different regions, Africa, Southeast Asia, and the Americas had a higher prevalence compared to Eastern Mediterranean countries. Continuing on with HIV statistics, crude mortality in the United States in 2021 was 1.5 per 100,000 population. When looking at case fatality in the United States, 2019, a total of 18,489 deaths were among people diagnosed with HIV, and then records from 2022 indicated that 630,000 deaths from HIV occurred worldwide, where 540,000 were adults and 84,000 were children. For infant mortality, the UNAIDS released a report titled MDG6 that revealed that in 2013, 17 countries from Africa reported that 42% of newborns did not receive HIV diagnostic services 60 days after birth for those who were exposed to HIV. And what they found was that for those newborns that did not receive HIV diagnostic services, 50% of them ended up passing away before the age of 2. Additionally, for those newborns that did not receive HIV treatment, then there was a peak mortality at 6 to 8 weeks after birth. In an article released by Golisano's Children's Hospital in New York, they discuss how in 2019 in the United States, there is less than 1% mother-to-child transmission for HIV compared to 25% from 1991. And this is a result of early HIV diagnostic services, in addition to prophylaxis treatment to the mother and child before and after pregnancy. And for changes in trends in the past few decades, we see that in the 1980s, an estimated 1 to 1.5 million people are infected with HIV in the United States. And 10 years later, it is reported that 52,690 people are diagnosed with HIV within a 3-year time period. And then 10 years later, we see that it is reported that 56,300 people were diagnosed with HIV in 1 year. And fast forward to today, we went over our numbers that approximately 34,800 people were newly diagnosed with HIV. And so while we do see that there is a little bit of a decrease in these numbers, the numbers have been pretty high. This has then led the Department of Human and Health Services to creating the Initiative for Ending the HIV Epidemic in the United States, which is composed of 4 key pillars. First, to diagnose people as early as possible. Second, to treat people rapidly and effectively. Third, prevent new HIV transmissions. And then fourth, respond quickly to HIV outbreaks to get services to people who need them. Throughout the decades, community health action has led to the awareness and demand for HIV prevention and treatment. And next, I'll be passing it over to my colleague Lydia, who will then be telling us a little bit more about HIV control and public health campaigns for HIV.
HIV prevention and control can take the form of prevention, treatment, monitoring, and risk protection. For HIV prevention, some methods include abstinence, not sharing needles, using condoms, and HIV prevention medicine such as pre-exposure prophylaxis, known as PrEP, and post-exposure prophylaxis, known as PEP. HIV treatment is known as antiretroviral therapy, which reduces the amount of HIV in the body to an undetectable viral load, also known as being virally suppressed. This helps people stay healthy, and most people can get the virus under control within 6 months. There are 2 types of HIV treatment, pills and shots. For HIV monitoring, if your HIV test is positive, the testing site or clinic will report the results to the local health department so public health officials can monitor the HIV epidemic in the area. The local health department will also de-identify personal information from the test results to send the information to the CDC, as the CDC is responsible for tracking national public health trends. Many states and cities have partner notification laws. In other words, if you test positive for HIV, you and your healthcare provider may be legally obligated to tell your partner. In the US particularly, HIV is mainly spread by having sex or sharing syringes or injection equipment with somebody who is infected with HIV. Substance use can contribute to these risks indirectly because alcohol and other drugs can lower people's inhibitions and make people less likely to use condoms. Some well-known HIV public health campaigns include the Rumors campaign from 1986 to 1987. This campaign was sponsored by the American Red Cross and the Ad Council. This rumors campaign was aimed to correct misinformation about HIV and AIDS, specifically regarding transmission. It included television, radio, print advertising, and community outreach materials for individuals, schools, and other organizations. This campaign was celebrity driven and was focusing on debunking myths about transmission, and the tagline was "Rumors are spreading faster than AIDS. For more information, write the American Red Cross." Another well-known public health campaign was the America Response to AIDS campaign, which was sponsored by the CDC from 1987 to 1996. This campaign was launched to raise awareness among all Americans about HIV and AIDS. This was created in response to a 1985 congressional mandate that required the CDC to educate the public about HIV and AIDS. Mail was sent to all U.S. households providing facts about HIV and AIDS transmission and prevention. Targeted campaigning to those at greatest risk of HIV infection was done, such as to minorities, sexually active young adults, and injection drug users. Parents were encouraged to talk to their children about AIDS. Parents were also encouraged to talk to their children about AIDS. The campaign also stressed volunteering testing and treatment, HIV risk reduction behaviors, such as abstinence and condom use. Lastly, the campaign promoted the use of the CDC AIDS hotline. The last campaign that I will talk about is the One campaign. This is sponsored by the Bill and Melinda Gates Foundation, as well as World Vision and other well-known organizations. The One campaign raised awareness from 2005 to the present about global HIV and AIDS and extreme poverty. The campaign encouraged political involvement and was a collective effort of philanthropic groups dedicated to fighting global AIDS. The title of the campaign came from the belief that an additional 1% of the U.S. federal budget should go towards fighting poverty in developing countries and providing basic needs such as food, water, education, and health services. The One campaign's television PSA shots include well-known celebrities such as Brad Pitt, Justin Timberlake, Ellen DeGeneres, just to name a few. Lastly, the call to action for the campaign was, "We're not asking for your money, we're asking for your voice."
That concludes our HIV presentation. Thank you so much for listening, and we hope everyone found this presentation informative. Thank you.